red blood cells, we have a basic understanding of red blood cells, right? We all know a little bit about red blood cells. Let's talk a little bit about the important elements of RBCs and why we need to understand them. First of all, males are going to have a higher normal level than females. For males, the normal level is about 4.5 to 5.5, and for females, it's about 4.0 to 4.9. The reason we're going to run this lab is to identify anemia or blood loss, okay? Red blood cells, what makes them so important is that they contain hemoglobin, and hemoglobin is responsible for oxygen transport throughout our body. Without red blood cells, we don't have a way to get hemoglobin, which carries oxygen, to the tissue, okay? So red blood cells are really like the transport mechanism for oxygen, okay? And that's because of hemoglobin. And RBCs are primarily produced in bone marrow through a process called erythropoiesis, okay? Erythrocytes is another name for red blood cells. So when you hear erythrocytes, you might hear erythrocyte sedimentation rate or erythropoiesis, erythropoietin. These are all referring to red blood cells. Okay, red blood cells have a lifespan of about 120 days, and they're destroyed in the spleen and the liver. So once they've lived their life, once they live their life cycle, they're destroyed in the liver, they're broken up, and hemoglobin becomes bilirubin, and we, separate all these things out. But RBCs are destroyed after about 120 days in the spleen and the liver. Production of RBCs is regulated by something called erythropoietin, or EPO. And this erythropoietin is produced in the kidneys. So what happens is as red blood cells pass through the kidneys, all this data is collected, okay? And if we sense that we're low on RBCs, erythropoietin is released, and this stimulates the bone marrow to produce more erythrocytes, okay? And then the new red blood cells will go out and do their job, okay? Some things that are going to cause this level to be increased are going to be things like dehydration, COPD, high altitude, pulmonary fibrosis, and some things that are going to cause it to be decreased are going to be things like chemotherapy, anemia, obviously, hemorrhage, hemolysis, leukemia, pernicious anemia, organ failure, bone marrow failure. So if our bone marrow is not able to produce red blood cells, we're obviously going to see a decreased level. So red blood cells are important. What our providers are going to be looking at most, and what we need to be looking at most of all, though, is really going to be hemoglobin hematocrit, right? Hematocrit is percent of plasma that is RBCs. And then hemoglobin obviously tells us oxygen carrying capacity of blood. Kind of compare those two, and we can see, what's our actual oxygen ability, So RBCs are important. It's good to look at these RBCs, good to evaluate them in determining overall health of our patient. Okay, so this should help you understand a little bit about what's going on and how RBCs work within the body.
Thank you for listening to our podcast today. Nursing.com is the trusted learning hub of all future nurses, your secret weapon for passing nursing school with your sanity intact. We want to invite all our listeners to visit us online and take advantage of a special promo offer. Just head over to nursing.com/free. That's nursing.com/FREE, and check out the free resources and other goodies that we have there just for our podcast listeners. Until next time, go out and be your best self today. And as always, happy nursing.